Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Hassan Akbar and I am a clinical physiotherapist by profession. In the part 1 of the disc bulge, हमने ये डिस्कस किया था कि disc bulge एक ऐसी spinal condition है in which the inner portion of the intra-articular disc, that is nucleus pulposus, it remains within the territory or boundary of the annulus fibrosis. But there is a change in the shape of the annulus fibrosis, and this change in the shape of annulus fibrosis in the form of a bulge that causes the compression of the nerve roots exiting from the vertebral foramen. And we have also discussed about the age of onset, the factors that causes the formation of the radical fissure through which the nucleus pulposus herniates, and the symptoms described by the patient that came under the subjective clinical findings. In this video, we will discuss about objective clinical findings and the general precautionary measures that must be taken by a patient suffering from the disc problems. तो अगर आपने मेरे चैनल को अभी तक लाइक एंड सब्सक्राइब नहीं किया तो काइंडली लाइक एंड सब्सक्राइब माय यूट्यूब चैनल। ऑब्जेक्टिव क्लिनिकल फाइंडिंग्स वो फाइंडिंग्स हैं जो फिजियोथेरेपिस्ट या ऑर्थोपेडिक सर्जन असेस करता है। इन द लंबर रीजन अगर हम ऑब्जेक्टिव क्लिनिकल फाइंडिंग्स की बात करें तो लंबर रीजन में अगर पेशेंट सफर कर रहा है फ्रॉम द डिस्क बल्ज तो प्रेफर करता है स्टैंडिंग एंड वॉकिंग in comparison to the sitting because of the change in the intra-discal pressure. Number 2, there is a decrease or loss of the lordosis in the lumbar region. Lordosis is the inward curvature of the spine. If it is to a small degree, it is considered as normal. If there is excessive inward curvature of the spine, that is considered as abnormal and it is associated with multiple musculoskeletal disorders. Number 3, there is a lateral shift of the spinal column. The lateral shift of the spinal column is defined as the upper vertebrae that laterally flexed either to the right or to the left in relation to the lower vertebrae and carrying the trunk with it. In most of the cases, the lateral shift is away from the painful side. But in 10% of the cases, the lateral shift of the spinal column is towards the painful side and it is also known as ipsilateral shift. Number 4, repeated forward flexion. Repeated forward flexion that causes the peripheralization of the symptoms. That means the pain travel towards the legs. Number 5, repeated backward flexion. Repeated backward flexion that causes the centralization of the symptoms. Centralization of the symptoms means the pain travel from the legs towards the lumbar region. Number 6, passive lumbar testing. It can be done in the supine and prone position. In the spine, double knee to chest is performed and in the prone position, the press-ups are performed. Both these tests that causes the aggravation of the symptoms of the pain. Number 7, if the straight leg raising is performed, pain appears between 30 and 60 degrees. And this shows the abnormality of the dural mobility.